Good afternoon, good morning. I'm Carrie Campbell, the Associate Director of Advocacy for Share Strength, and I want to welcome you to today's conversation on the White House Conference on Hunger, Nutrition, and Health, and more specifically on Share Strength's policy recommendations for this conference. I see that there are still a few people who are still joining us, but we want to go ahead and get started being mindful of everyone's time. I am joined today by my wonderful colleague, Carolyn Vega, the Associate Director of Policy Analysis at the Center for Best Practices. And we look forward to a great conversation about the conference and an update on the conference, but more specifically about our policy recommendations to really make bold transformational change for our nutrition policies, federal nutrition policies. So a couple of housekeeping. As is typical for today's webinars, this call is being recorded for future use. And I do want to let everyone know that we do have some wonderful team members that are monitoring our chat function. So if you have any questions or comments throughout the program, please feel free to put it in chat and we'll do our best to get to them by the end of the call today. So before I turn this over to Carolyn, just a couple of updates on the White House conference. As many of you know, back in the spring, the White House announced its conference on hunger, health, and nutrition, championed by Congressman Jim McGovern and other members of Congress. This is the second time in our nation's history that such a conference has existed. And back in 1969, when the first conference was held, it really created some pivotal changes to our nutrition policies. Among other things, it created the Food and Nutrition Service. It significantly expanded our SNAP program. It created the permanent authorization of school breakfast program. It launched a pilot program of what we now know as WIC, and it created the first dietary guidelines for Americans. These were really meaningful policy changes, and we're hoping to see the same thing come out of this conference in 2022. This is a really important opportunity for us to strengthen our nation's commitment to ending not just childhood hunger, but hunger at large, which is why the White House has the goal of this conference of ending hunger by 2030. This conference, the White House post-conference, is going to put forth a blueprint for our nation to make updates and changes to our nation's federal nutrition programs and how children get the food that they need. Years of data and research have demonstrated that the federal nutrition programs are our nation's most effective defense against hunger, poverty, and food insecurity, lifting millions of American families out of poverty. This matters. As you all know, adequate nutrition, both at school and at home, is essential to a child's physical and emotional development, health outcomes, and educational attainment. That's why our core policy recommendations that the White House requested, those bold policy recommendations that we submitted in July, really go to these key components. So to go a deeper dive into what those policy recommendations are, I'm going to turn it over to Carolyn to share with you what we submitted to the White House. Carolyn?
Thank you, Carrie. First, though, I want to start off with the conference pillars. So when the White House announced preparations for the conference back in early May, they provided 5 pillars to set the scope of the conference. So improving food access and affordability, integrating nutrition and health, empowering consumers to make and have access to healthy choices, supporting physical activity, and enhancing nutrition and food security research. So you can see that this is quite broad, and a reminder that this is a conference on hunger, nutrition, and health, not just hunger. But for example, climate and sustainability and other things are not a part of the scope. So that was what the 5 pillars are really about, is setting the scope of the conference. But that said, our recommendations really do center on this first pillar. We know that we can't achieve nutrition and health without tackling hunger. And obviously, just with our mission, that is really our focus. So we wanted to make sure that there was adequate attention at the conference on that first pillar and ending hunger. So that is where we put our time and energy, but we know that there are many other organizations that have also submitted recommendations and are working on those other pillars as well. So if you go to the next slide, I first also want to talk about our process for developing our recommendations. Given the short time frame, again, we had from early May to mid-July when the White House wanted recommendations. And also, given the current political climate, we started with our existing priorities for child nutrition reauthorization and also the priorities that we're developing for the upcoming Farm Bill, rather than totally starting from scratch, going back to the drawing board through talking with people, as much as maybe we would have loved to kind of embark on that thought exercise. The time just didn't really allow for that. So we kind of started with that base of our existing priorities, but we did add on top of that a network survey. We got more than 175 complete responses. So thanks to all of you who took the time to let us know your thoughts. We didn't do a broad listening session. Many other organizations were doing listening sessions, including the White House. And we just knew that planning for a scale of inviting our entire network of partner and supporters just wouldn't really be feasible. So that's why we did the survey. But we did do 2 smaller listening sessions, one with state agency partners, so the state government agencies responsible for administering the child nutrition programs. And then we also did a listening session with our Mayors Alliance to End Child Hunger. So that included mayors and mayoral staff, just to get their more unique perspectives, I suppose. Not to say that everyone's input wasn't extremely valuable. So we took all of these things together and developed our recommendations. So here on this slide, I have the kind of overarching buckets or categories for what we sent to the White House, but we're going to talk through each of these in a little more detail. So going to our first bucket, center lived experience and equity in policymaking and programs. So with this, we really just stated that engaging people with lived experience of hunger and experience participating in safety net programs should not be a one-time exercise for this conference, and that it's critical to ensure that policies and programs respond to the needs, challenges, desires, the cultural needs of the people they aim to serve. So we also just called out the importance of getting a variety of perspectives, again, on an ongoing basis, based on people from different geographies, people with different living situations and circumstances, different identities, and that this is so important, again, not just for the conference, but on an ongoing basis. We also recommended leveraging tools like the Health Equity Index in developing policies to target and tailor supports for specific populations that experience disproportionate rates of poverty and hunger. We also advocated for consistently collecting and making publicly available de-identified data on individuals eligible for and or participating in safety net and food assistance programs, just so that we can better identify and support underserved communities. Also advocating for supporting equity and food sovereignty for tribal communities by engaging with tribal communities and allowing them to administer federal nutrition programs. And then more on the implementation side, we recommended providing consistent training on equity, diversity, inclusion, and trauma-informed care to the staff who implement these food assistance and safety net programs. So moving on, our next category of recommendations, modernizing, streamlining, and coordinating safety net programs. So this category included a lot of recommendations around modernizing computer systems and technology, knowing that that can really facilitate reporting and data and information sharing. It can also improve data access and quality to support analysis and research. Again, going back to the previous category, it can also support identifying underserved communities. And also investing in computer systems can streamline application processes within and across programs. Another category or another recommendation within this category is streamlining the requirements for schools as well as for nonprofits that are operating multiple child nutrition programs. As I'm sure many of you know all too well, there are slightly different sets of rules for each of the programs that can create a lot of barriers and challenges. So we recommended streamlining all of those for both schools and nonprofits across summer and after school and school programs. We also recommended coordinating and co-locating services to help families get the support they need. So that includes both a kind of no wrong door approach that families get referrals and application support for other services whenever they access one. Also included a recommendation for memoranda of understanding between agencies to support coordination of services and sharing that eligibility and application information to just make it easier for families to access the programs for which they're eligible. Also recommend providing support through schools with things like SNAP outreach, SNAP education programming, and health services. And then for younger kids to co-locate WIC services in venues where families are already present, like health clinics and things like that. And then also on the health side of things, we recommend expanding Medicaid's covered nutrition supports to include produce prescriptions. And we also recommended setting holistic eligibility thresholds and benefit levels to avoid a benefit cliff effect for families, that as they earn a little bit more, their benefits drop off more than their increase in income. And related, we recommended ensuring benefit adequacy and exploring regional differences to account for differences in cost of living. So that is it for that category. So moving on to the next is strengthening SNAP. And we have a lot of different things in this category, including improving technology, a recurring theme in many of our recommendations, in order to streamline administration and promote equitable access. And included within that, we recommend making permanent some COVID-19 flexibilities like telephonic signatures and telephone interviews, knowing that not everyone can make it to an office in person to complete those steps. We also recommend expanding and improving online ordering through SNAP, including expanded access in rural and other underserved communities, ensuring that delivery fees are not a barrier, and ensuring that smaller retailers can also provide online ordering and delivery services through SNAP. Again, a recurring theme, we recommended strengthening the collection and disaggregation of data within SNAP to better identify where there are gaps. We recommended increasing the threshold for eligibility to 200% of the federal poverty level from where it is now, acknowledging that many families struggle to purchase enough food. We also recommended promoting community engagement, outreach, and participation among underserved communities, and providing opportunities for meaningful input from SNAP participants. And related, we have recommended support for various special populations, including immigrant communities, noting the ongoing need to remedy the confusion caused by changes to public charge rules under the Trump administration, for tribal communities, wanting to allow households to participate in both the food distribution program on Indian reservations and SNAP in the same month, which is currently not permitted. Also wanted additional support for US citizens in Puerto Rico, American Samoa, and the Northern Mariana Islands by providing a pathway to transition from the current nutrition assistance program in those areas to full participation in SNAP. We want to also ensure access to SNAP for military families and for college students. We also recommended providing USDA with permanent authority to issue nationwide SNAP waivers in the case of future crises, so we're not waiting on special authorization from Congress for each emergency situation. And we recommended protecting client dignity and autonomy by preserving client choice for food purchases, and instead promoting the purchase of more nutritious foods by enhancing accessibility, affordability, education, and incentives. And related, promoting healthy food purchases by further investments in the Gus Schumacher Nutrition Incentive Program, or GUSNIP, including the integration of those GUSNIP funds with SNAP benefits on the same EBT card. Whew. All right, so that's a lot of talking, and we still have more to go. So moving on to our next bucket, the child nutrition programs, improving and enhancing access. Obviously, we've got a lot here since that is where so much of our focus is. So in the category of summer meals, we recommended a permanent and nationwide summer EBT program to provide a grocery benefit to families with children eligible for free or reduced price meals during the summer months. And we also specifically recommended leveraging all of the lessons learned from pandemic EBT in implementing a permanent summer EBT program in order to minimize the burden on schools and state agencies, streamline access for families, and knowing that investing in adequate data technology systems is critical in order to achieve that. So we definitely, in the course of our listening sessions and survey, heard support for summer EBT, but also heard from that and from all of our other experience that it can be a bit of a pain point. So we tried to take that into account, knowing that it is such a valuable service and support for kids and families, but also knowing that there are ways to really make it better based on what we learned through the experience of pandemic EBT. Also on the topic of summer nutrition, we recommended that there be a permanent non-congregate option for the summer meals programs. We saw through the pandemic how critical this was and how it supported access to summer meals and how it helped to overcome all of the longstanding barriers we know about, like transportation and weather and all sorts of other things that keep kids from getting meals in the summer. So we advocated for that to be a permanent option in the summer programs. We also advocated for a lowered area eligibility threshold. So knowing that waiving the area eligibility threshold may not be a likely permanent policy option at this time, we did at least advocate for it being lowered from 50% eligible for free or reduced price meals to 40%, which can really help to expand access in some rural and middle need communities, as well as better align with funding for out of school time programming like the 21st Century Community Learning Center. And then reiterating a recommendation from above, we also called for streamlining options for schools and nonprofits that serve summer meals along with school meals and after school meals. In the category of school meals, we called for extending the benefits of no-cost school meals by expanding the community eligibility provision with a lower minimum identified student percentage and a higher multiplier, as well as making direct certification for free or reduced price school meals with Medicaid data a permanent and nationwide option. And we also recommended support for data sharing to really make that possible and maximize that opportunity. We also called for eliminating the reduced price category, which would raise the eligibility threshold for free school meals for more students. And we also called for improved direct certification systems and systems for free and reduced price applications. We also threw in a recommendation advocating for an updated definition of a school so that virtual learners would have access to benefits like summer EBT and pandemic EBT in the future. We know that virtual learning took off in the pandemic and it's not necessarily going to go away. And so we would like to see that gap addressed. And then we also had several recommendations under the WIC program, the Special Supplemental Nutrition Program for Women, Infants, and Children. So we want to promote the purchasing of nutritious fruits and vegetables by permanently increasing the value of the cash value benefit. And we want to remove barriers to accessing and utilizing WIC benefits by expanding access to online shopping and delivery, by increasing the flexibility of WIC appointments with remote visits and extended certification periods. And again, as mentioned earlier, co-locating WIC services in other venues. We also want to improve the shopping experience to better meet the needs of participants by increasing some flexibility in the WIC food packages. And we also want to promote awareness and a sense of inclusion among all birth parents, grandparents, other caregivers, and guardians who could benefit from the program. Okay, and that is it on our recommendations related to the child nutrition programs. And again, I do just want to note as we go along that this is not exhaustive of every possible thing in the world. Again, this was just based on, some of our child nutrition reauthorization priorities, layered in with some additional things that rose to the top through that kind of input gathering process. But I know there's so many other improvements that are out there that could be made to these programs that we would love to see eventually in the long term. But moving on to our next bucket of recommendations, preparing for future pandemics, emergencies, and periods of economic hardship. We wanted permanent waiver authority for USDA during pandemics and other emergencies. We know that was such a huge issue throughout the pandemic that Congress had to extend it and reauthorize it many times, which led to lots of confusion and difficulty with planning and looking towards the future. So we recommended that be permanent authority so that that state agencies can better plan policies and procedures, that there can be training and better preparation so that people know what to do when these things occur. We also recommended that there be adequate funding and benefit levels during periods of rapid inflation. We know that's been a struggle recently where reimbursement rates only adjust annually, but prices are going up much more quickly than that. And we see that as an issue for child nutrition operators with their reimbursements, as well as for families that rely on things like SNAP benefits. We also recommended creating a permanent pandemic EBT system for future pandemics and other emergencies. So currently that's only authorized for the COVID-19 emergency. And then we also recommended creating a standard system for data collection and reporting during emergencies. And lastly, the last category is using the tax system to boost family income. So we recommended permanently reinstating the American Rescue Plan enhancements to the child tax credit that we saw in 2021. And that includes increasing the amount of the credit, having it be fully refundable, and having it provide advanced benefit payments rather than waiting until you file your taxes. We also recommended enhancing access to the earned income tax credit by phasing in the credit more quickly, boosting the maximum benefit, and extending eligibility to workers without custodial children as young as 21. And then we also recommended spacing out EITC earned income tax credit payments to keep families from living most of the year in poverty, so providing that support throughout the year. And that is it. So thank you for that laundry list of recommendations, listening to that laundry list of recommendations. I know it was a lot, but we sent a lot to the White House. And again, thank you all for your input as part of this process. So I will turn it over to Carrie now to go on to what's next.
Thank you so much, Carolyn. That was an earful, but it was very impactful. So what comes next with the conference? Just last week, the White House announced the official date of the conference will be Wednesday, September 28th, so just 20 days from now. Although we don't really have many more specifics after that, we don't know the time frame of morning and night and who's going to be speaking and attending. We do know that this will be a hybrid of both in-person and virtual, so people from across the country can participate and see all of the great policy recommendations that have come forward and the strategy that the White House is going to move forward on. They have been working and receiving feedback, as Carolyn just shared, from Share Our Strength, but then from diverse perspectives all across the country, from folks with lived experience, from local partners and community leaders, and national organization and others. And so we're really looking forward to that bold strategy that they're going to put forward and move forward on. So Share Our Strength is going to continue to lead these types of briefings with our different stakeholder groups. And I want to say thank you to many of you who helped inform the policy recommendations that we submitted. And we're going to continue to share those out with our different partners. And the White House, in addition to the policy recommendations that they have asked for from different folks, they're also reaching out to individuals in those same organizations, particularly people with lived experience, to make commitments to work to reach this goal of ending hunger by 2030. And Share Our Strength is continuing to work on what our commitments are going to be. But for now, I can tell you the two focus points that we are looking at are making a significant pledge to support and strengthen school and community meals between now and 2030. And we're also looking to expand our partnerships with healthcare leaders to increase access to training and resources that will ensure that children and families have equitable access to food that they need in order to thrive. So look forward to hearing more from us on those two commitments that we're making. And then lastly, and very importantly, is share strength in others in the White House are really looking to see what we can do to make sure that this isn't just a one-day conference, that it doesn't end on September 28th, but starting September 9th and beyond, where are those opportunities that we can engage with different stakeholder groups, with you all and others, in order to ensure that we are able to attain this goal of ending hunger by 2030. And we look forward to continuing to work with you on those priorities. So with that, I am going to open this up for questions, either on the conference itself to what we can answer or on our priorities. And Carolyn, I see that there's some questions in the Q&A. And the first one is from Kathy May on who would be the one to choose USDA to be allowed to govern the waivers.
I was looking at that one, and it is a great question with a few layers, but I will invite the person who asked this to offer additional clarification in case I don't quite get it right. I will say we did not dictate all of the specifics in our recommendations to the White House. So we did not say these are exactly the circumstances and how this will work in total detail. In general, this is a recommendation that would require congressional action. So on some level, ultimately, Congress would have to set some of those parameters of under what circumstances USDA would have that authority of, it's a federal public health emergency, it's a, state or federal disaster or something like that. So we did not say exactly what we thought that should be in our recommendations, but in general, it would be the responsibility of Congress to give USDA that authority and set the circumstances in which they would have it versus just normal operations. So again, if you were trying to ask something a little bit different, please go ahead and type in any clarification that you were hoping to get on that one.
So Amanda Messia, I believe, I'm so glad that you love these nutrition policies, and we will certainly be in touch with you about how you can get more involved in supporting these priorities as we learn more about the program of the conference itself and post-conference. So thank you for that.
Yes, thank you, Amanda. We are always grateful for your partnership. I recognize your name. And I'll say, kind of building on my last comment as well, a lot of our recommendations and a lot of, whatever may come out of the conference may require congressional action, as I said. So as we always have, we will continue to advocate through child nutrition reauthorization and the Farm Bill. So certainly those will be opportunities in the future. When we see those, coming up in Congress, and when we see opportunities to advocate, we certainly will ask for the support of you all in pushing those things forward.
So Carolyn, I don't know the question about how focused the summit will be on schools and the role of public education or role of education or broader. You may have something to add here, but I will say that it is this conference on health, hunger, and nutrition, so it is encompassing a lot in this one conference. So I don't think it's going to be completely focused on schools and education itself, but I think it's going to be more of that broader perspective, given the diverse group of individuals as well as organizations that the White House has been working with. I think you're going to see a much broader holistic approach that they're really trying to achieve here.
Agree. That's been my understanding all along, that this is not just limited to children either, it's everyone from birth through older adults. So ultimately, we're eagerly awaiting, whatever the White House releases going into the conference, and to see what happens at the conference and what that conversation looks like. But yeah, it will not be limited to schools, and kind of TBD again, how much of a focus that is within whatever the White House puts out and within the conversation. But trust me, we want it to be a big part of the conversation. So we will do what we can to put focus there, knowing how important children
So there's the question, Carolyn, from Sally about universal meals and the decision not to push for universal meals.
Yeah, it's a great question. I know it's been an ongoing question and discussion for a long time now. Obviously, we want every child to have access to school meals as well as summer meals and all the healthy meals they need 365 days a year. I guess going back to what I alluded to just of the current political climate, we put in recommendations that we thought were bold, but still within the achievable realm within the relatively near term. And that is unfortunately just something we have not seen appetite for at the federal level. I think if everyone remembers even these past few months in our advocacy on the Keep Kids Fed Act and getting waiver authority extended, that waivers for everyone to have access to free school meals during the coming year didn't happen. We couldn't even get eliminating the reduced price category over the finish line for just this coming year, much less a permanent universal meals. So as much as that's something that we would love to see in an ideal world, we just didn't put it in knowing that it may not be feasible again in the short term at the federal level. That said, we do, see it and support it at the state level. And I suppose there is a play because this is broader than, again, just congressional action for states to take that up as a call. And we certainly fully support that. So that's just a little bit of kind of what that thought process was. And again, where our head was at in terms of that approach of like, again, if we were starting with what's our ideal world completely separate from where we are currently, our recommendations probably would have looked a lot different in a lot of different regards, not just that. So. But I guess related, I do see the question about how the White House conference may affect bills in Congress currently, like child nutrition reauthorization. And I think that is $1 million question of exactly what may happen in Congress, whether separate from those kind of existing efforts like CNR or as part of them. So we were eagerly waiting to see how the conference really does shape the conversation in Congress. So your guess is as good as ours at this point. And yes, Sally, following up on your question about universal free meals, that we may have another 50-year wait. I hope it's not that long, but we would love to even just see CNR really happen, and we've already been waiting a long time for that.
And I do see the question about will the conference be open to everyone. So as I mentioned, it's a hybrid. What we hear, and I'm reluctant to say this because we have not heard this directly, publicly from the White House, but what we have heard is that in person, there'll be probably about 500 people attending in person. And so that is by invitation only, but the conference itself, because it is a hybrid, will be able to access it via anyone around the country who registers. So the expectation is that, yes, it will be available to everyone. And I think there was someone who had their hand raised. To your question about registering, that they have not put out the link to register yet. I think they're still waiting on those specific details on timing and getting all of the specifics up and running. So once we know, we'll certainly keep you informed.
I'm gonna ask our lovely webinar coordinator, are we allowed to unmute people? How does that work? I see a couple of people with hands raised.
Yeah, I went to click to see if they would like to unmute.
Okay.
Lindsay, I think maybe if you unmute.
Also welcome questions via chat and the Q&A box if you're not able to ask your questions on the line.
Lindsay, I think we're having a little technical difficulty unmuting. So if it's okay with you, if you could put your question in the chat, that might help us with our technical issues.
Okay, sorry. So the chat is disabled for participants, although I think you should still be able to chat us directly in addition to typing in the Q&A box.
Our apologies for the technical side. This is the world we live in these days. So, Carolyn, I don't know if you want to take that question that just came in.
Sure. This might be off topic, but how do you best recommend telling families they cannot take meals off site if they ask why they can't? A lot of families and site staff seem to be upset, wondering if there was a best practice for that. That is a tough one, and that is exactly why we are advocating for non-congregate summer meals. We know that it is a really difficult transition now for families, especially. I will poll my colleagues after this. I want to say they have a resource on this, but I'm not positive right now. But I think going back to the fact that it is the federal regulation and that, you know, previously it was a pandemic flexibility, you know, just as briefly and succinctly as you can, but to let them know that it wasn't necessarily your personal decision and that, you know, you're just kind of caught up in these broader factors. And I think just whatever can be done to make the site as accessible and welcoming to families as possible can go a long way. And if it is at all possible to have external funding to offer family meals, that can also help because we know it can be challenging if parents have to sit there while their child eats and they're not allowed to eat with their child. So it's a good question. It's why we advocate for non-congregate meals, and we will see what we can do to follow up if we have more resources after the webinar. We also see if the recording will be available. And yes, we are recording today, so we will work to make that available to attendees. And we can also reshare the blog post that we put with some of our core priorities as well. We also have someone, because we can't have the chat enabled for everyone, Sally wanted to share in response to the question about telling families they can't take meals off-site, to be empathetic, to say you're sorry and understand, and also recommending a low price for adults. So that may be a good option if you don't have that separate private funding for adult meals. So acknowledging that, yes, most times kids are brought by an adult, so making sure things are welcoming to adults as well is important. Thank you, Sally. Well, we are happy to stay on the line for a while longer to answer what we can about our policy priorities, for the conference, knowing that we do not have all of the details, and even the White House does not have all of the details quite yet. But just want to say for now, thank you so much for joining. And again, thanks to everyone who completed the survey and provided input on our recommendations.
I would also just like to add, if you think of other questions after this call, if you or you want to follow up with any comments, please feel free. You can email me at ccampbell@strength.org, and I'm happy to answer anything that I can, or maybe direct you to the best person who could answer your questions. But with that, I think we're going to go ahead and close since no questions are coming in. I hope you all have a great day. And again, thank you for joining us. And we certainly will be in touch with you with any updates as they come in. Thank you all.